One of the big things that's very confusing is the medication. You have a lot of different medications that you take at different intervals of the day and night around the clock. You have, besides your pain medication, you'll have an antibiotic for sure, and you'll have something to keep your digestive system working, and then all sorts of pills. You'll have a Valium. Usually they put you on Valium because they don't want your muscles to contract, so that helps keep you calm and keep your muscles from moving because they've just been repaired. So all sorts of little drugs like that you don't typically take that you'll take. It's very confusing because one is every 4 hours, one is every 6 hours, one is every other time you take this, and then each other time you take that. So you have to really get that down to a rigid schedule. And the one thing that really helped, writing it all down, writing down your last dose, and writing down when you take it, and then writing down your next expected dose. So you could mark off each time you took it and then write the next time you needed to take it. Your head will not be remembering all this, and you will have different caretakers coming in and out though. Yes. I mean, you won't have the same person around the clock. So one thing that helped, especially at night, is we got these little medication cups like you would use with a child cough medicine or something like that.
And where can those be purchased?
I actually think we got these at Walmart, but I'll look around and check. Or a drugstore, and you can just ask for them behind the counter. We would write the time, like this one, 8 a.m., this is 10 a.m., 2 p.m., and so on. So anytime there was a time of day that we needed pills, these would be lined up for the entire day and entire night with the appropriate pills already in there. So first off, most of the time you'll be sleeping in the beginning. Someone will have to wake you up. We had little bottles of water or juice or whatever you could tolerate, and all you had to do was wake up enough to take your pills that were in the 8 a.m. cup, and that was done. You could go right back to sleep. It wasn't real disruptive. You got the pills that you needed at the time that you need them, because that's real important.
Also, your caretaker typically will be sleeping also, and so it takes a little pressure off of your caretaker because you are very concerned about making sure you get it right at the right time. And so going ahead and setting everything up before you go to bed is very helpful also to the caretaker.
Right, and the bottles, the pill bottles, the names are never what you call them. They're the real name. They're not the generic name. So we took a Sharpie and wrote on the lid, if it was, you also had to take a sleeping pill. So if it was Lunesta 2 milligrams, we wrote Lunesta on the top because the bottle had that long generic name. So that's real helpful too. In the middle of the night, it's easy to get them confused. There's lots of bottles, lots of people make medication errors. So writing, or even, oxycodone, if you write oxy on the top, you know what that is, that's your pain. Or even just write, pain, or, antibiotic, or something like that on the top, so that you're more clear with what the drug is, and don't have to worry about the generic, don't have to turn on the light. Really, you've all got it right here. Let's see about pills. I would say to you two, first, I think I put this on the list, and this will give you an idea of how weak your chest muscles will be. You can't push and turn for a childproof cap, so you need to make sure that when you get your pills from the pharmacist and from here for quite some time, that they fill your prescriptions with a regular snap-off cap, and you're just going to have to remember, if you have children in the house, that they need to be in a safe place, but they can't be, once you start doing more things for yourself, you're not going to be able to push and turn a childproof cap. There were just a